The optimal scale is recommended by Medicare for uh, recording functional abilities in your outpatient physical therapy, generally Part B. I'm going to show you how to fill this out today. I'm Tim Richardson. I'm a physical therapist. Here we have our optimal baseline on the left, and we have our optimal follow-up on the right. Today's date, Maria is her name. Maria's gone through and filled this out. She's received very little coaching or help from her physical therapist. This is a difficulty scale. It does not assess pain. So she's said that she can lie flat without any difficulty. She can roll over with moderate difficulty. That's a 3. She can move from a lying to sitting position with moderate difficulty. That's a 3. She can sit without any difficulty. That's a 1. Encourage your patient to rate the scale according to how well they do the activity, not according to their pain. When they're done rating the scale, go through and sum the columns. 1, 2, times 1. Okay, so you can add them or multiply, but that ends up being a 2. I hope you can see these numbers down here. This is column 2, 1, 2, 3, 4, 5, 6 occurrences of 2. 6 times 2 is 12. Okay, 1, 2, 3, 4, 5 times is 15. Okay, and then 5 times 4 is 20. Note that these columns, or these categories of activities, have not been summed. Hopping, jumping, and running, that's fairly common. A lot of patients choose not to do that. We're going to pull that out of the denominator. Instead of having 21 is our denominator right here, we're going to have 18. Okay, so then we'll sum 2 plus 12 plus 15 plus 20 is 49. We'll divide that by 18, which is our new denominator, and we'll get 2.72. We've carried it to 3 decimal places. I encourage you to carry it to 3 decimal places in order to show improving trends, despite the fact that statistically that may not be fully correct because the patients have only given us 1 data point. Okay, carry it to 3 decimal places. It will help with if you're showing expected improvement. Note that she went from a 2.72 to a 2.27. She decreased in a couple of areas, like here at lifting and carrying. She went from a 4 to a 3. Note that she was a 4 over here. Okay, a lot of the 3s at the initial went to 2s. And you can see that here. And that's reflected in the overall scores, 41, which is a lower score than 49. Lower scores are better. Okay, so she went, overall, she was between a 2 and a 3, somewhere between moderate difficulty and much difficulty overall, to the low 2s, or a 2.27. Now, if we were not carrying them to 3 decimal places, this would be a 2 and this would be a 3. It would still show an improvement, but I think less information. So this is the optimal scale. Before we finish, let me just point out the 3 activities that you would most like to be able to do without any difficulty. If we had filled this out completely, let's say Maria had put in lifting and carrying, and she would just fill in the number 20 and the number 21 here. We would use this with our goal setting, and we might say one of our functional goals would be to improve lifting from a 4/5 to a 3/5. Of course, at the 1-month follow-up, her goal has been met. This is a functional goal, and it's totally appropriate to just extract the data straight from the optimal scale without having to get any more elaborate than that. And so this is a very helpful piece of information here. The other thing I use this for is for my PQRI, Physician Quality Reporting Initiative. I'll extract this data straight from the optimal, plug it into my PQRI data sheet, have the patient sign it, and make sure I say, hey, these are the goals we'll be working on. Do you agree with that? Is that okay? Is that what you would like to do? They sign that, and we've fulfilled the qualification for patient co-development of the plan of care. So that's would qualify for the 1.5% bonus, as long as you collected two more of the criteria. So use the optimal instrument. It's a benefit. It's a tool that every outpatient physical therapist should be using.